Hey y'all! So my name is Kia and I am a registered nurse, and today I wanted to talk about heart failure. Mm. Listen. Mm. But before I talk about heart failure, I wanted to do a disclaimer. All right, this ain't for you to study from. This is just to get a gist of what heart failure is in a quick little video, or if you have a family member, or if you just want to educate yourself on um, different diagnoses that the body goes through. So basically, heart failure is the inability for the heart to pump or fill adequately. Okay, so there are commonly two reasons why someone would experience heart failure. Those two reasons are increased age. Okay, that is just what it is. Get older, stuff don't pump right no more. Or CAD, which is coronary artery disease. Coronary artery disease. Okay, and of course there's going to be other underlying issues why someone could go into heart failure, and those other underlying issues a lot of times comes from these risk factors. Okay, all preventable, or most of the time preventable, right? And that's why education is so important. So you're going to have your hypertension, you're going to have your diabetes, you're going to have your obesity, you're going to have your smoking and high cholesterol. So it is very important to understand the anatomy of the heart and how things flow. So basically, you have two sides of the heart, the left and the right. So blood is dumped into the right side of the heart, then it goes into the lungs to pick up oxygen, and after that it goes into the left side of your heart, and then after that it goes into your body. So again, right side of the heart, lungs, left side of the heart, body. So in order for us to determine if a patient is going through right-sided heart failure or left-sided heart failure, there are many signs and symptoms that we may see. So the signs and symptoms that you will see from a heart having issues on the right side is going to be edema, weight changes. So anytime you have edema, of course there's going to be weight changes, because now you're talking about fluid in the body. So these patients, the legs, or family members, unfortunately, that's when you see it, the men and women walking around with the crazy swollen legs. A lot of times that is heart failure. They're gonna have JVD, jugular vein distension. So that vein on the side of that neck is gonna be popping. You're gonna have ascites, so that's basically fluid in the abdomen area, and also it tends to be like a little hard. They're gonna be tachy, which is increased heart rate, and it's gonna be an enlargement of the liver. These patients are also going to be fatigued, right, from the right side, fatigue, chest pains. Now on the left side of the heart, right, we have left side heart failure. So again, anatomy, flow of blood. The blood went to the right side, hit the lungs, and that's what's going to the left side. But because the blood flow is not adequate, it's going to jump back into the lungs. So that's when you're going to get the pulmonary congestion. With pulmonary congestion, you're going to hear crackles. Like when you listen to the patients with a stethoscope, you're going to hear the crackles. Because there's all this congestion and everything going on, now you're going to get sputum, coughing. The sputum is going to be nasty. Like, you want to keep tissues by their bedside. It's going to be like pink and frothy. And then also they're going to have difficulty breathing, because again, you get your oxygen and everything from the lungs. Anytime you have difficulty breathing, any issues with breathing and oxygen, there's always a possibility for mental status changes. So you may see them acting a little wacky. Like, you'll see a patient come in day one with some, left-sided heart failure, and by the time a lot of the interventions are done, you'll see their personality has changed. So yeah, this is some signs and symptoms that you will see, and of course, it's not limited to these things, but these things are important. all right? And then some tests that will be done to determine, you know, a patient's, you know, status would be BNP levels, which is a lab. They'll do chest x-rays, echoes, and stuff like that, troponin levels. And for us, especially nurses, some interventions that we do is we always want to assess. We want to see if there are any changes in mental status, the lungs, the edema, the weight changes. So that's what we're going to be doing, daily weights. We're going to be sitting these patients up at a 90-degree angle, semi-Fowlers, because they're having a hard time breathing. They also have a hard time sleeping because they cannot breathe. So you definitely want to keep them sitting up. You're going to be monitoring their I's and O's, watching what they drink, watching how much they're peeing, you know, keeping measurements of it. A lot of times the doctor, the doctors or healthcare provider, because it can be MPs and PAs, they will put them on restrictions. So sodium, salt restriction, or a fluid restriction. And then the drug therapy often includes diuretics, which is water pills, and then also vasodilators. So you want to get those, you know, you want to get that blood flowing through the body again. And then lastly, I should put it in the other order, but education, y'all, education. And again, the risk factors that's listed up here, a lot of them are preventable. So it's important to educate your patient so that, number one, we can prevent. And also, let's say they are in this situation that they have the ability to know when something is wrong, you know, and then they know when to seek medical help, because a lot of these things can be prevented. So, and this is basically the gist of heart failure, and I hope that this video served you. And please like, subscribe, comment, and follow me on Instagram at unorthodox_nurse. And I hope that I'll be able to bring you guys more videos. So thank you.